Good morning, I'm Dr. Ying Go, that's spelled Y-I-N-G-Goh, Director and Health Officer for the City of Pasadena Public Health Department. Welcome to this Pasadena Community Flu Clinic offered in partnership by the Pasadena Public Health Department and Huntington Hospital. Each year, flu viruses cause millions of illnesses, hundreds of thousands of hospital stays, and often tens of thousands of deaths in the United States. The best way to protect yourself and your loved ones against flu is to get a flu vaccine every year, every flu season. Dr. Schreiner and I wanted to answer a few common questions today, such as, why should I get the flu shot, especially this year? Getting the flu vaccine now as we enter into flu season is the best way to protect yourself and your loved ones from the harmful effects of flu, such as respiratory complications. People can be infected with both flu and the virus that causes COVID-19 at the same time and have symptoms of both. Getting vaccinated can prevent this. You also reduce the likelihood of transmitting flu to your friends, family, and coworkers, and reduce the likelihood that you need a trip to the doctor or the hospital. It does not protect against COVID-19, so both shots are needed. When large portions of the community get flu shots, we reduce community transmission of the flu and hospitalizations due to the flu, which allows more healthcare resources to be available for treatment of other diseases, including COVID-19, which is so important in the midst of this pandemic and heading into the winter season. Because some of the symptoms of flu, COVID-19, and other illnesses are similar, the difference between them cannot be made simply by symptoms alone and require testing for diagnosis. So if you have symptoms, please get tested for COVID-19 and isolate at home. Who should get the flu shot? Everyone 6 months and older should get an annual flu vaccine consistent with CDC recommendations. The flu shot is especially important for people with medical conditions and pregnant people who are at risk for worse outcomes from flu. This season, get vaccinated for flu and COVID-19 and layer on other measures for protection, such as wearing a mask, staying at home when you're sick, and washing your hands frequently. How effective is the flu shot? Efficacy varies from year to year, but in general, the flu vaccination reduces the risk of flu illness significantly by 40 to 60%. It can also make flu illness milder and prevent hospitalization. There's so many convenient places to get a flu shot: at your doctor's office, retail pharmacies, at the Pasadena Public Health Department immunization clinics for free. In addition, our website lists many pop-up community clinics available in the coming weeks. Next, it's my pleasure to introduce Dr. Kimberly Schreiner from Huntington Hospital. She's an infectious disease doctor.
Thank you very much, Dr. Go. It's my pleasure to be working with the team here with the Pasadena Public Health Department, an excellent organization that has really been battling very significant respiratory illnesses over the last 2 years. As Dr. Go has said, we are concerned that we may have a bit more of a flu season this year than we did last year. As you recall, we were mostly on lockdown last year. Everybody was wearing a mask. We were very concerned about COVID. And so, like most of the world, we did not have a significant flu season. But this year, the schools are open. People are out and about. They're enjoying company of their families and friends. Hopefully they are vaccinated against COVID, so that gives them a little bit more freedom to do that. And for that reason, we're very concerned that this year might be a more significant season for influenza. Like COVID, influenza is a preventable disease with a very safe, effective, and widely available vaccine. It is good for all individuals, including pregnant people and people who are immunocompromised. And as Dr. Go said, those individuals often will have more serious consequences if they get influenza. We encourage people to go ahead and start getting their flu shots as soon as possible. Again, it's widely available at most pharmacies, at grocery stores, at the Pasadena Public Health Department, in clinics, and by private practitioners. You can get the COVID shot and the influenza vaccine at the same time if you are not vaccinated against COVID or fully vaccinated against COVID. Sometimes you might think about separating the two vaccines just a little bit in case you have a side effect, but you can get them at the same time. They are safe to give together. Like COVID, influenza presents with shortness of breath, fever, sore throat, but it also can have achy bones, and you don't seem to lose the sense, a loss of taste and smell that we see with COVID. Because they're very similar symptoms, however, if you have those symptoms and you're concerned about COVID, if you're not vaccinated, or you're vaccinated and you've been around people with with COVID, then we strongly encourage you to get tested for coronavirus before you and isolate unless pending the results. Influenza is a much shorter course of illness usually, but it can have serious consequences, and so that's why we strongly encourage you to get vaccinated. It is, again, a very safe vaccine. It's being given widely around town now, so it is available. We'll see how the year goes. Influenza can also be prevented by good hand hygiene and masking, just like COVID. These two viruses together could be very serious, and so we encourage you to get vaccinated against coronavirus with the very safe, widely available COVID vaccines if you're not vaccinated, and to get the influenza vaccine at the same time. I'm happy to answer any questions, as I'm sure Dr. Go is as well, as needed. Thank you. With the influenza vaccine? Well, you know, the influenza vaccine has been around for years and years and years. We know it's highly effective at preventing influenza. That vaccine is adjusted every year according to what kind of flu virus is circulating around the world. The COVID vaccinations have been implemented this year, and I think that makes people nervous because it's a relatively new vaccine. The truth is, it's probably more widely tested than any of our annual influenza vaccines because we're in the middle of a pandemic and there's just an abundance of COVID-19. So we were able to test those vaccines very quickly with huge numbers of people. At this point, 1.7 billion people, that's a B, around the world have been vaccinated against COVID. Very, very, very safe vaccines, very, very high rate of effectiveness, higher, frankly, than the influenza vaccine. That disease is, of course, in some respects more deadly than influenza, although influenza can be a very serious illness in elderly and in pregnant women and also in immunocompromised people. So the two vaccines are extremely safe. They do not change your genetic material. They do not cause infertility. They do not cause miscarriages, and they will protect people from both of these viruses. Very, very safe, and so we strongly encourage you to get vaccinated.